Hello, good evening, everybody, and thank you for joining us. My name is Tal, and I'm the Educational Director at the American Academy of Functional Health. And with us, we have Dr. Chill.
Hi, everybody. Welcome.
Today's discussion, we're going to go over a case study. This is going to be a diabetes and metabolic dysfunction case study, which kind of gives you an example of how you can integrate the functional approach. And we call this like integrative functional medicine, right? Where many of our community members, they're coming from primary care, right? I would say almost most of them coming from primary care. So when we look at diabetes, and I'll take diabetes as an example because it is unfortunately so common. There are over 38 million people with diabetes, and they're talking about 98 million adults at high risk of diabetes, maybe pre-diabetes. Those patients are managed with different medications such as metformin, insulin, which plays a very important role in the management of this condition. Unfortunately, so many of those patients, even on medication, continue to progress, develop cardiovascular disease, stroke, blindness, kidney failure, and lower limb amputation. Here's a few of the statistics. 4 out of 10 diabetic patients have chronic kidney disease. 5 out of 10 diabetic patients will develop a foot ulcer during their lifetime. The Veteran Affairs Diabetes Trial reported that diabetes neuropathy is diagnosed in 3 out of 10 diabetic patients. And then 1 out of 10 diabetic patients report a significant decline in their vision. So we also know that new studies are calling dementia type 3 diabetes because of the similar mechanisms. And the thing that hurts me the most when I look at those statistics is that the American Diabetes Association reported in 2021 that diabetes led to the death of 103,294 Americans. Because essentially that means that on average, every day, 283 diabetic patients die. And those are scary numbers. So if you think about it, 283 diabetic patients die every day because of those complications. What else can we do to change those statistics, right? Those are neighbors, friends, somebody's mother and daughter and father, right? So that's why we want to learn functional medicine. So let's take a look at an example of a case study and what can we do to change things, right?
This is a typical case, and it's an actual case study that I went over with one of the practitioners in our program. So this is going to, well, as we're going through this, you're going to start to see some of the approaches that we use to be able to integrate the functional medicine side of things into a primary care type of setting. And this is what we were doing with this practitioner. So with this case, this was a 41-year-old female patient who was previously diagnosed with diabetes type 2. They presented to the office with concerns of continued weight gain, so they weren't able to lose weight. They had digestive complaints, fatigue, and brain fog. So this is a pretty typical presentation of many patients that we will often see in some variation of this in our office. So what I had the practitioner do was I had them have the patient fill out a functional medicine health survey. What showed up and what was revealed in the survey was that the patient's lifestyle included that she was eating sweets on a daily basis. She was having refined flour on a daily basis, having milk products. She had a family history of heart disease along with depression. And then she had food sensitivities to dairy, which is interesting because she was eating milk products every day. And then she also had food allergies to shellfish. Now, there is a difference between food sensitivities and food allergies, and we dive into that in a deeper discussion in the gastrointestinal section and the gut health section of the advanced program. The functional medicine health survey, it is going to break down different body systems that may be impacting and contributing to the patient's symptoms. And this is going to help guide us into determining which body systems are actually the underlying factors to the patient's symptoms, or maybe even causing the patient's issues, conditions, and symptoms. So we'll kind of dive into some of those health areas that we're going to consider for this patient. One of them was possible low stomach acid. So this is an area that's in the functional medicine health survey. The patient just fills out if they have daily symptoms to a certain symptom, if they have monthly symptoms to a certain symptoms, or if they don't have any. And the patient with possible low stomach acid presented with 2 to 4 symptoms, either daily or weekly. Some of those symptoms included bloating, burping, discomfort after meals, indigestion after meals, a burning sensation 30 to 40 minutes after eating. You can start to see that this is a pretty comprehensive tool, and it's going to be really efficient at saving practitioners time because they fill this out instead of the practitioner going through every single area with them. They'll actually really just kind of look at the functional medicine health survey and already get an idea of which areas they need to assess for the patient to be able to address and provide the functional medicine approaches for them. Another area that was checked off for this patient was possible dysbiosis, in particular SIBO. She had over 6 daily symptoms. Some of them included abdominal pain, discomfort, abdominal distension, diarrhea. Remember that a part of the patient's chief concerns was digestive symptoms, and then also an inability to lose weight. So understanding that, we're already starting to get a picture of what's going on with this patient and some of the underlying causes. And we're seeing that the microbiome imbalance or the gut health is a major contributing cause for this patient. In this example, we're going to discuss how the microbiome has an interplay with the metabolic issues, diabetes, along with weight gain, right? So we can see how the microbiome impacts our cellular function, our metabolic issues, along with our insulin function. So we can see how the changes in the gut microbiome in this picture, and then the loss of integrity of the gut, which we can see at the top there. This can lead to a migration of pathogens into the pancreas, which is responsible for the beta cells and insulin. And this goes through the bloodstream to the portal vein and the pancreatic ducts, which we see there. And then on the bottom, we can see how these pathogens can be taken up by antigen presenting cells, including macrophages, dendritic cells. These all can process and present antigens to autoreactive T cells, and this is going to initiate an autoimmune reaction that can promote the destruction of pancreatic beta cells. And happens typically with genetically predisposed individuals. Through many of the published studies on this topics, we are now understanding that some bacteria is associated with chronic diseases. So this is what we can educate this patient on how the gut microbiome is impacting her metabolic condition.
So here's another example of a trigger that we're going to dive into in functional medicine that is a major contributor to metabolic dysfunction, and that is subclinical systemic inflammation. Chronic inflammation, we know that ongoing inflammation causes damage. Inflammation is important for healing. Inflammation is important for fighting pathogens. The problem is with chronic ongoing subclinical inflammation is that it causes the polymorphonuclear neutrophils to generate reactive oxygen species. So essentially, those are free radicals that cause damage to the cells and the organs. For our discussion today is what we really want to focus on is the damage to the cells that promotes cell senescence. Essentially, a biological process where a cell permanently stops dividing, changes in the cell that causes some damage. And while the cell is still metabolically active, it's still there, it's active, but it also is not working properly. So it releases harmful substances that can contribute to metabolic dysfunction, such as senescence associated secretory phenotype, or in short, SASP. And what we're seeing here essentially on the top left, we can see how senescence in pancreatic beta cells, again, those are cells that due to different factors, that could be inflammation and reactive oxygen species, those cells now they are there, they're active metabolically, but they're not entirely completely functioning properly, right? And so as a result of that, they're not functioning as well, right? And they're spewing out molecules that are damaging the nearby cells. So essentially, this is where you can see how senescent cells in the pancreatic beta cells, they play a major role in beta cell dysfunction. Now, if you got beta cell dysfunction, you got reduction in secretion of insulin, which contributes to impaired glucose homeostasis and diabetes. That's what essentially one of the major factors of diabetes, right? Less insulin. So if you see patients that have a reduction in insulin production, we have to ask ourselves, what's happening in their pancreas? What's causing that dysfunction? On the right top side, we can see the involvement of senescent cells that are in the adipose tissue, which is our adipocytes, right, or fat tissue. If there are senescent cells developing in the adipose tissue, they essentially start to secrete more inflammatory cytokines, chemokines, and growth factors, which contribute to systemic inflammation. So again, that's contributing to that vicious cycle of inflammation. In order to address lack of insulin, we have to figure out what's causing the beta cells dysfunction or senescence and treat the metabolic dysfunction. And to treat the metabolic dysfunction, we have to find the root causes of inflammation. And as I mentioned, there are several factors that can lead to inflammation. That's a big part of functional medicine, right? So one of them is the gut, the transfer of molecules, pathogens, environmental factors into the bloodstream, where you get a massive reaction, right? That's what we call endotoxemia. That causes systemic inflammation. It could elevate C-reactive protein. With some patients, would elevate inflammatory cytokines such as interleukin-6, right? So that's why we have multiple different types of tests for inflammation, right? We don't just measure C-reactive protein with every patient and say, oh, it's low, you don't have inflammation, you're good to go, right? We have a whole panel. We have different ways to measure reactivity, immune reactivity. We wanted to show you those two triggers because they're all connected. Gut microbiome or dysbiosis can contribute to inflammation, which elevates reactive oxygen species, which contributes to senescent cells. So you can already start to understand where we're heading with this, right? In our treatment protocol, long-term, when addressing the root cause, we would need to address the gut. We would need to address nutritional deficiencies. We would need to address what's causing the senescent cells, and we would want to address what's causing the chronic inflammation. And so we could prescribe her the standard of care approach, which is metformin, send her to a dietitian to count calories. There's some studies, by the way, that show that that's very counterproductive for patients. We can, we can give her some Red Bulls for her fatigue, right? But all of those will be very symptomatic Band-Aid approach, right? So we always want to learn what else can we do for our patients to provide valuable and comprehensive services. So really appreciate, again, you for being here. I hope you take care and best of health, and we'll see you in our next class.
So your patient count on you to provide them with answers, with guidance and solutions to their health concerns. And this one-day summit over the weekend is a great opportunity to offer comprehensive care to your patients, talk to them about the root causes of their chronic conditions, and provide them simple strategies that they can take to start restoring their health and improve your clinical results. So here's everything that is included with your ticket. You get access to all the live classes. It's clinically focused, which means that you learn and you can apply. We're gonna go over the most important functional medicine labs. We're gonna include nutritional and supplement strategies. we're gonna license to you the use of the functional medicine evaluation tool and a clinical treatment guide that took us about 15 years to develop. We're gonna go over case studies and show you how to put everything you're learning and apply it in real clinical scenarios. And you're also gonna get the recordings, and you'll have access 24/7 to all the recordings on demand, so you can go back to it at any time if you choose to. Plus, you're gonna get support from us, so if you have any questions, you can reach out to us. We're giving an early bird special of $1,000 discount, so take the next step and save your seat for the Clinical Functional Medicine Summit. We will take you step by step through the mechanisms, the pathways. We'll look at the specialty functional medicine labs. We'll show you how to use the clinical evaluation and treatment guides. And we'll even show you case studies, how to put it all together, how you can set up some of those in your practice. We will be there to answer all your questions. So I look forward to seeing you. I'm very excited for you. Thanks for watching. My name is Tal from the American Academy of Functional Health, and I'll see you there.